dental student, a pre-dental student, a dental hygiene student. Wherever you are in your dental journey, welcome to this video, and I sincerely hope that you've learned a lot about the field. So with that, let's talk about dental terms used every day in the field of dentistry. So first, let's get oriented with the mouth. Of course, we have the lips here that form the outer border of the mouth. We have the teeth, we have the tongue, we have the roof of the mouth, which is also called the palate, which is divided into a hard palate, which is towards the front of the mouth. It has underlying bone, and the soft palate, which is towards the back of the mouth. It includes this hanging bit of soft tissue called the uvula. The tonsils are also in the back of the mouth, and they serve as part of the immune system. Now we've separated the teeth from the previous diagram, and the patient is open as wide as possible, and we have the upper teeth up here and the lower teeth down here. And note how the teeth form an arc or an arch, like you see in certain architecture. So we call this one the upper arch, or the maxillary arch, because the upper jaw that joins these teeth is called the maxilla. And we call this one the lower arch, or the mandibular arch, because the lower jaw that holds these teeth is called the mandible. Now we all have 4 different kinds of teeth. The first kind are called the incisors. We have 4 incisors in the front of the mouth for the maxillary arch, and also 4 incisors down here in the front for the mandibular arch. There are 2 central incisors and 2 lateral incisors in each arch. These are used for incising or slicing food, like when we bite into an apple, for instance. Of course, the 4 upper incisors also play a big role in our smile lips, and they help with speech, like F and V sounds, for example. The canines are next, and we have 2 of them in the upper arch, right next door to the incisors, and we also have 2 in the lower arch. They're also called the eye teeth because they're located in line with your eyes. They're used for carrying and holding food, and also contribute to the aesthetics of someone's smile in the case of the upper canines. The premolars are next, and we have both a first and a second premolar in each quadrant of the mouth. So we have 2 premolars here, 2 premolars here, and then we have 2 and 2 down here. And again, we have a first and a second premolar in every quadrant of the mouth. They're used for carrying, holding, and grinding food. And lastly, we have the molars. So we have 3 molars in each quadrant of the mouth. We have a first, a second, and a third molar. The third molars are also called the wisdom teeth, and they're the most commonly missing teeth in the mouth. Molars are used for grinding and mashing food. I should mention that these are the adult teeth. So let's talk about the baby teeth. The baby teeth, also called the primary dentition, are shown here. And we have 20 of them in total. We have 20 baby teeth when all of them come in. There are 4 incisors per arch, 2 canines per arch, and 4 molars per arch. Note that there are no premolars in the baby teeth. They start coming in at around 6 months of age.
जो स्क्रिप्ट आपने दिया है इसके मुताबिक आप सारे 12
And baby teeth should
रियलिस्टिक
have fallen out
पिक्चर्स को
by
आप
at around
क्रिएट
age
कर रहे हैं, ठीक है?
12.
जो
Teeth
स्क्रिप्ट
falling
आपने
out of
दी
the
है इसके
mouth.
मुताबिक आप काम का जो है
On
आप
the right,
एक
we have
पिक्चर
the
को जो है
adult teeth, also called
सेलेक्ट करें
the
और साथ
permanent
में जो है
dentition.
शॉर्ट का
We have
शॉर्ट
32
ये
in
शॉर्ट
total.
वीडियो के लिए बना रहा
Of
हूँ
course,
शॉर्ट
some
करें
people have
उसके
extra,
लिए आप एक
and some
नहीं
people
बनाएं, ठीक
have
है?
missing teeth.
इसी स्टोरी के
These
मुताबिक जो आप
teeth start to
सकते
run
हैं
at around age 6, and then hopefully they never exfoliate as long as our teeth remain healthy. Alright, so I told you there are 32 adult teeth, but how do we number them? Well, there are 3 main numbering systems that dental professionals like reading a book. You start in the top left corner, which is this tooth right here. And then you go
अच्छा आप ऐसा करिए ये जो है मुझे शॉर्ट के लिए चाहिए
So I want
ठीक
to
है
point out really quick
तो अच्छे
that
पिक्चर्स
this
बनाओ
side
स्टोरी के
is the
मुताबिक
patient's right side and this is their left side. Remember, we're looking at the patient straight on. So tooth number 1 is right here. That's the upper right third molar. Then we just go in order from there. Tooth number 2, number 3, number 4, and so on. So we go around the upper arch until we got to this tooth over here. There's the upper left third molar, tooth number 16. After that, we jump down to the lower arch. Then lower left third molar is tooth number 17. Then we get to the number right here, 18, 19, 20, 21, 22, keep going, all the way around to the lower right third molar, which is tooth number 32. So the upper right third molar is always tooth number 1. The upper right central incisor is always tooth number 8. And so every tooth has a predetermined number from 1 to 32. For the palmar notation, we break the mouth into 4 distinct quadrants. The vertical line straight down the center of the mouth is called the midline. This horizontal line is simply separating the maxilla, the mandible. The palmar notation is a little bit different. That we don't go above the each quadrant has 8 teeth. We start at the midline and work our way out. So the central incisors are always tooth number 1. The lateral incisor is always going to be tooth number 2. Canine will be 3. First premolar will be 4. Second premolar will be 5. First molar, second molar, and third molar. And that's true for every quadrant in the mouth. So we can do this for every single quadrant. Now you might be wondering, well, how do we distinguish between the 1s, the 2s, and all the other teeth among the
अच्छा
different
आपने
quadrants?
thumbnail नहीं
Notice how
बनाया
the
है ना
lines
इस वीडियो
intersect.
स्टोरी के मुताबिक
So
आप शॉर्ट
this
thumbnail
corner
बनाओ शॉर्ट
marks
साइज में
a
शॉर्ट
backwards L. This corner
यूट्यूब शॉर्ट
marks
वीडियो बनाते हैं
normal
उसके
L.
मुताबिक आप एक
This
thumbnail
one
बनाओ
forms
ठीक
an
है
upside down
तो आप
L,
अगर
and then
मैं जान
this one
सकते हैं
over
इस आपको
here
जो बेहतर
is
लगे
an
अच्छा
upside
बना
down
ठीक है
reverse L.
ये आईना
So
लगे
every quadrant is a unique symbol. So now all you have to do is take the symbol for that quadrant and then assign a number based on the tooth we're talking about. So if we're talking about this upper right central incisor, you just put a 1 within this symbol. If we're talking about this upper left canine, put a 3 on this symbol. If we're talking about this first premolar in this quadrant, you're just put a 4. And then down here in the lower right, if we're talking about, let's say, the second molar, just put a 7 on that symbol.
अच्छा आप इसे ट्राई कर लो वो भी अच्छा
So,
बना सकते
if
हो इसे
you're
भी अच्छा
surgeon,
बना सकते
might
हो
get a referral from the orthodontist
क्या
to
वक्त
extract
ये
the
गवर्नमेंट
upper
ने बनाया
and
था
lower
ऊपर जो आपने बना के दिया था
and that
इस
means
तरह
the
क्या आप
first
एक
three
सेकंड की
molars.
कीमत जानते हैं
Now,
इस तरह की
that's a
इंटरनेट
whole
को
lot
बना
easier
सकते हैं
than saying, please extract tooth number 5, number 12, number 21, and number 28. So you can see how the symmetry and the simplicity of this system might be preferred by orthodontists and oral surgeons, for example. And lastly, we have the FDI, World Dental Federation System, which uses 2 digits. The first digit tells you the quadrant that you're in. The upper right is quadrant number 1, upper left is quadrant number 2, lower left is quadrant number 3, and lower right is quadrant number 4. Now the second digit is the exact same as the palmar notation, 1 through 8, 1 being central incisor, 8 being third molar. So now instead of using the symbols here, we just use a number. So for the upper right central incisor, we would call this tooth number 11. The first one for the quadrant, the second one for the number. Let's pick this lower left second premolar. This would be tooth number 35. And so you can do this for every quadrant of the mouth using that method. So if you're curious, this is how we number the primary dentition for the baby teeth. For the universal system, instead of using numbers, we use letters. So instead of number 1 to 20, because there are 20 baby
साल की
We
कीमत
still
उससे
use
पूछो जो फेल
two
हो गया है।
digits, but for
एक
primary
मिनट
teeth
की
and
कीमत
quadrants
उससे पूछो
are 5,
जिसकी
6,
ट्रेंड छूट गई है।
7, and
एक
8
सेकंड की कीमत
instead
उससे
of 1,
पूछो
2,
जो
3,
एक्सीडेंट
4.
से बार बार बचा हो।
And the second digit
वक़्त
would just
ज़िंदगी
go
का सबसे
from
कीमती
1 to
हिस्सा है।
5, like in
एक
almost.
उस्ताद ने एक तालिब इल्म से
So
कहा,
those are the three
एक साल की
most
कीमत
common
उससे
tooth
पूछो
number
जो फेल हो गया
systems.
है।
So next time you visit your
एक
dentist,
मिनट की
you
कीमत
can
उससे
impress them
पूछो
by
जिससे
pointing
ट्रेंड
out
छूट
a
गई हो।
certain tooth
और
and
एक
its
सेकंड की
number.
कीमत उससे पूछो जो एक्सीडेंट से बार बार बच गया हो।
So now let's talk about the tooth
सबक का
surfaces.
मकसद ये है
So a
कि
tooth
वक़्त
consists
ज़िंदगी का
of
सबसे
both a
कीमती
crown
हिस्सा है।
and a root. The crown is the part above the gum. The root is the part below the gum. The crown of the tooth has different surfaces on it. Just like a cube has 6 surfaces, so does the tooth's crown. There's a front and a back, a left and a right, and a top and a bottom. And every surface has a name except for the bottom because it's connected directly to the root underneath. So the front of the tooth is called the facial surface. If we look at our diagram over here on the left, this would be the facial surface for tooth number 3. This would be the facial surface for tooth number 8. And this is the surface of the tooth closest to the face. That's why it's called the facial surface. Interestingly, there are other names that can be used to describe this surface depending on where you are in the mouth. So if you're talking about a front tooth or an anterior tooth, that refers to the incisors as well as the canines. This facial surface can also be called the labial surface. That's because it's adjacent to the lips. If you're talking about the back teeth or the posterior teeth, that includes the premolars and the molars, the facial surface can also be called the buccal surface, which is another name for the cheeks because those surfaces are adjacent to the cheeks. The back surface of the tooth is called the lingual surface. And on the diagram, this would be the lingual surface for this tooth, and this would be the lingual surface for this tooth. Now this is the surface of the tooth closest to the tongue, that's why it's called lingual. In the upper arch, we can also give this a different name. We can call it the palatal surface because it's adjacent to the palate, which is the roof of the mouth up here. The side of the tooth that's closest to the midline is called the mesial surface. M or midline. So for tooth number 3, this would be the mesial surface. For tooth number 8, this would be the mesial surface. All of this is true of the lower arch as well. Next is the distal surface. That's opposite from mesial. It's the one that's furthest away from the midline. So for tooth number 3, this would be the distal surface. Tooth number 8, this would be the distal surface. And you can imagine that everything would be kind of a mirror image to the
फेल हो
side
गया
of
हो और
one's
एक
root.
मिनट की कीमत उससे
So
पूछो जिससे
this would
ट्रेंड
be the
छूट
distal
गई हो।
surface for tooth number
और
9.
एक
This would be the
सेकंड
distal
की कीमत
surface
उससे
for tooth
पूछो
number
जो एक्सीडेंट
14,
से
for
बार बार
instance.
बचा हो।
And
सबक
lastly,
का मकसद ये
we
है कि
have
वक्त
the
ज़िंदगी
chewing
का कीमती
surface.
हिस्सा है।
This is called the occlusal surface, which comes from the word occlusion, which refers to the upper and lower teeth coming together. Now, in the anterior region, this is given a different name. This is called the incisal surface. So the incisors as well as the canines. In the posterior teeth, these biting surfaces are all the occlusal surfaces. Alright, so teeth also have different layers. You've probably all heard of the enamel layer. That's the hard, calcium-rich surface of each tooth. Enamel is actually the hardest tissue in the human body. Dentin is the surface underneath the enamel, and it makes up the bulk of these roots here. Notice how there's no enamel in the root structure. Dentin is a little bit softer and more yellow color than the enamel because it has more organic material. pulp is the soft tissue inside each tooth, and it contains blood vessels as well as nerves. The pulp chamber is the part that's in the ground, and the pulp canal is the part that occupies the root. The gums are the reddish pink tissue that surrounds each tooth. It's kind of like the skin around your fingernails and toenails. It can be also called the gingiva. The bone that is underneath the gums and houses and holds each tooth in place by the roots is called the alveolar bone. The alveolar bone is part of each jawbone that we talked about briefly before. The upper jawbone is called the maxilla, the lower jawbone is called the mandible. The cementum refers to the thin, hard tissue that covers the root of each tooth. Now this tissue has similar density to bone. And lastly, we have the periodontal ligament, which is this tissue right here. It's between the cementum and the alveolar bone. Now we have lots of ligaments in our body, and they usually connect one bone to another bone. But in this case, with the periodontal ligament, it connects a tooth, which is not technically a bone, to the alveolar bone. Tooth decay is the result of germs in our mouth, specifically oral bacteria. The bacteria feeds on sugars in our diet, and then they process this sugar to produce acid. The acid melts away the mineral content in our enamel, and then our dentin. It starts out small and unnoticeable, but then can grow to produce these big holes and cavities. A loss of mineral of the tooth due to the byproducts of bacteria is called caries, which comes from the Latin cariosis, which means full of decay. Gum disease is the other main disease process that occurs in our mouths. Plaque refers to a collection of bacteria on the tooth surface, also called biofilm. If this plaque is not removed by mechanical brushing and flossing, the bacteria can not only melt away our tooth structure like in caries, but can also anger our gum tissue, which is called inflammation, which can make them red, swollen, and even painful. Gingivitis is an early form of gum disease where the gums become inflamed, so they're red, swollen, and can bleed easily. Again, it's usually caused by plaque buildup near the gum tissue. If this plaque stays around for a long period of time, the situation will get even worse. And then we get to what's called periodontitis, which is a severe infection of the gums. It involves not only gingival inflammation, but the gums and the bone that supports the teeth can retreat and recede away from the plaque. When severe or chronic, teeth can loosen over time and even fall out if enough bone is lost. So the difference is gingivitis is reversible, while periodontitis is irreversible. The names of each also explain exactly what they are. Itis means inflammation, so gingivitis means inflammation of the gums, and periodontitis means inflammation of the tissues that surround the tooth. Now let's go over some specific terminology for dental treatment. So restoration refers to any kind of treatment that repairs or replaces teeth. So this can include fillings that replace decayed or missing tooth structure, but this also includes some bigger procedures like crowns and bridges that we'll talk about in a little bit. So amalgam is a dental filling material made up of a mixture of different metals such as mercury, silver, tin, and copper. It's also known as a silver filling. Composite is a tooth-colored filling material used to repair or cosmetically enhance teeth that's made of several types of resin-based plastic substances. Bonding is another term that some dentists may use, and it refers to the process by which a tooth-colored filling material is attached to the tooth. A sealant is a thin plastic resin coating that can be placed on the biting surfaces of back teeth to help prevent caries from forming within the pits and fissures of these teeth. part of a natural tooth that's covered with enamel, but it's also the name for a filling that covers the entire natural crown when the tooth has broken down and can't be fixed by a smaller amalgam or composite filling. Crowns can be ceramic to match tooth color, or they can be gold metal like this crown here. A bridge is an appliance that is cemented in place, just like a crown, but it replaces missing teeth. So if this tooth was completely missing, for example, the bridge would cover the adjacent teeth, and then a fake tooth would be placed in this empty space to replace the missing tooth and bridge the gap there. Another way to replace a missing tooth or teeth is with a denture. So this is something that's taken in and out by the patient and can be a partial denture like this one to replace some missing teeth, or it can be a complete denture if all of the teeth of that arch are missing. An implant is another option
उस्ताद ने एक एक उस्ताद ने एक शागिर्द से पूछा, एक साल की पूछो जो फेल हो गया हो, और 1 मिनट की कीमत उससे पूछो जिसकी ट्रेन छूट गई हो, और 1 सेकंड की कीमत उससे पूछो जो एक्सीडेंट से बाल बाल बचाओ। इसका मकसद ये है, इस स्टोरी का मकसद ये है कि वक़्त जो है ज़िंदगी का कीमती असासा है। आपने वक़्त क्या आपने आज तक अपने वक़्त को ज़ाया किया या नहीं किया? कमेंट में बता दें। Good trick, good. Yeah, trick. एक उस्ताद ने एक शागिर्द से पूछा कि 1 साल की कीमत उससे पूछो जो फेल हो गया हो, 1 मिनट की कीमत उससे पूछो जिससे ट्रेन छूट गई हो, और 1 सेकंड की कीमत उससे पूछो जो एक्सीडेंट से बाल बाल बचा हो। इस मोटिवेशनल स्टोरी का मकसद ये है कि वक़्त ज़िंदगी का सबसे कीमती असासा है। क्या आपने आज तक अपने वक़्त को ज़ाया किया है या नहीं किया है? आप कमेंट में ज़रूर बता दें, अपनी राय दे दें। ठीक है, अल्लाह हाफिज़। एक उस्ताद ने एक शागिर्द से पूछा, 1 साल की कीमत उससे पूछो जो फेल हो गया हो, 1 मिनट की कीमत उससे पूछो जिसकी ट्रेन छूट गई हो, और 1 सेकंड की कीमत उससे पूछो जो एक्सीडेंट से बाल बाल बचा हो। इसका मकसद ये है, इस स्टोरी का मकसद ये है कि अब जो इंसान का वक़्त है, वक़्त ज़िंदगी का सबसे कीमती असासा है। यानी आप अपने वक़्त की कदर किया करें। वक़्त जो है आपको एक बड़ा आदमी बना लेता है, और वक़्त जो है आपको सक्सेसफुल मैन बना लेता है। अगर आपने आज तक वक़्त ज़ाया किया है या नहीं किया है, आप कमेंट सेक्शन में ज़रूर बता दें। अल्लाह हाफिज़, सी यू इन द नेक्स्ट मोटिवेशनल वीडियो। एक उस्ताद ने एक शागिर्द से पूछा, 1 साल की कीमत उससे पूछो जो फेल हो गया हो, 1 मिनट की कीमत उससे पूछो जिसकी ट्रेन छूट गई हो, और एक सेकंड की कीमत उससे पूछो जिसकी जो एक्सीडेंट से बाल बाल बचा हो। इसका मकसद ये है कि ज़िंदगी में जो वक्त जो है, टाइम जो है, ये प्रेशियस है। ज़िंदगी का सबसे कीमती असासा जो है वो वक्त है। यानी आप अपने वक्त को जो है कीमती बनाएं और अपने वक्त को ज़ाया नहीं करें। जिसने अपने वक्त को कीमती बनाया है और वेस्ट नहीं किया है, वो आज सक्सेसफुल मैन है, बिकॉज उन्होंने अपने वक्त को कीमती बनाया है। तो अपने वक्त की कदर करें एंड बी अ सक्सेसफुल मैन। तो अगर आपने अपने वक्त को ज़ाया किया है और अगर आप नहीं ज़ाया करना चाहते, तो आप जो है मोटिवेशनल वीडियोस को देखो। इट विल बी अ ह्यूज लेसन फॉर यू। आई विल गिव यू अ लॉट ऑफ लेसन्स फॉर एवरीवन, मोटिवेशनल लेसन्स। सो अगर आप नए हो, आप मेरे चैनल को जो है आप सब्सक्राइब करें और इस वीडियो को जो है आप शेयर करें और लाइक करना कभी भी मत भूलना। कमेंट आपने ज़रूर राय देना है। अल्लाह हाफिज़। ऐसे
Vem das piques.
Acho que tinha um pouco.
Era correr aqui.
Agora buraco eu estava com o destino, o negócio.
Hata buda shukuru ile wagwani wa sabama shame kajum da gazanta mai tanu le dine
Aqui,
kajum
Batiro.
bas
شو لك شفت
mamun khali wa kan taba bude
Da exato, hein?
da zat kachrar da zai fikru Allah
Ne da uli baş kapısın başta.
Larga base. Base não como base base é má.
Și telefonul card de așa cum nu se vede.
Ora pune tot să facă.
Mungkin ada kedul harus sih serap berbuasa.
Ya nu se khali ka kamu da kamu se bena da pesa.
Dine uli se bale bede pun. Sadar kan
mish
ni.
mat mish
Ha? कैसा है?
ma pa sedita no meio sarsu
गोली राफिस गोली दिखनी थी.
Corria bem
bunu
cheio.
kabayan de
Aga da vai ter a.
is paida
Não tem outra cidade, eu não vou levar você, mas se quer essa lição. Mas se quer da sua lição, da vai ter que mexer com o stick da sua assim.
Nada va खराबी ना सब है. Nada no खराब है.
Rafiq na cadeira de
Deixa बोली के से instala que vamos.
Contigo, dele, vai chegar.
Começar por time شو شيء اللي دايم تشتري. SB 200.
ita pa
Não, lá será que eu vou? Mas se você fala no YouTube, vai eu. دي راك بطاري لو
استلقوا آخريهم شندي استلقوا كل شيء
تفكروا
استلقوا
يا غباسي
نج خالد كلا بات يا غبا باسي مش بدا كل خراب دي ناي ساس پانی برکت پشتان ठीक थी مش بدا ایران بس مش پیسو ته بول
يا
مش
بيسو
بدا 15 سال
تفكروا
دوی ته غورو خو لیکن هغه د زندگی مکمله تباس
ويا وسبراسي
او د سپنسري زنان استا هغه سم په خپل کې غاښونه ګرځي پرې لیکن دغه سپنسري زنان هم سم په خپل کې باندې غاښي چې دي راځه لا ورا لې درې سال په ور کې وای
ما خلاص وصل شپږ داري يا مصطفى في جنب مو خلاص ما هذا يكون
یا مثلا نه في خلاص د شپې ترې ورځ بجې خلاص دا ډېر درد به بالکل ختم شي فورا
So a general dentist can provide the treatments we just talked about, but there are specialists who receive specialized training for dealing with more complex cases. There are more specialties being added every year, but as of recording this video in 2020, there are 12 ADA recognized dental specialties. Dental anesthesiologists are specially trained to provide management during dental procedures, particularly things like deep sedation and general anesthesia. Dental public health specialists focus on advocating for dental and oral health issues at the community level, things like water fluoridation. Endodontists treat problems of the tooth, nerve, pulp, or infections in the bone associated with infected nerves, with procedures such as root canal treatments. Oral medicine doctors diagnose and manage patients with disorders of the face and mouth and provide biopsies, medical management, and specialized injections. Oral pathologists specialize in the research, identification, and management of oral disease. Oral radiologists specialize in the production and interpretation of dental x-rays. Oral surgeons perform tooth extractions, trauma surgery, corrective jaw surgery, and implant placements. Orofacial pain specialists are specially trained to diagnose and manage head and neck pain like headaches, migraines, and jaw pain. Orthodontists correct the position of teeth with braces and other appliances. Pediatric dentists specialize in treating children and patients with special health care needs. Periodontists specialize in treating the periodontal tissues that surround the teeth, this includes the gums and periodontal ligament,
ما شاء الله.
the cementum.
First
And
number.
prosthodontists
You are
replace
so
missing
lucky.
teeth with crowns,
No,
bridges,
مشكلة
dentures,
سقط
and
كريم.
the restoration of
شبيه
implants.
ولد.
These artificial
Well, this
teeth
could go on
replacements
the
are known as prostheses,
Well,
hence the name prosthodontist.
ما شاء الله. وين
And
الزبالة؟
lastly, there are a few more miscellaneous terms that I'd like to
بديت
review
تجربة ما أصدق
listed
فيديو
here
مسخري
in
بقول بس
alphabetical
شاطر
order.
لك.
First, we have abrasion. This refers to wear on a tooth,
على مجي
usually caused by
مجيك
brushing
شاطر.
too hard or using a toothpaste that's too
إيه دعوة
abrasive.
طبعا.
This is what it can look
They
like.
were selected.
Scrub,
You are some poor ذكر
with
مش
your toothbrush.
ولا تشتوي خلاص مش كل
A
يسكت
band
يقوم.
refers to a metal
مش
ring
glass
placed
platform.
around a tooth
يوم
with
ستيل
cement
يقوم.
as part of orthodontic treatment. The bite wing is an X-ray of the crowns of the upper and lower molars and premolars. It's the most common X-ray taken at a routine exam. Bruxism refers to an unconscious habit of grinding or clenching the teeth, which often happens when a person is sleeping or stressed out during the day. Calculus or tartar refers to a hard deposit of minerals coated with plaque that can build up on the teeth and cause gums to get inflamed. The most common place for it to accumulate is the lingual surfaces of the lower incisors. And this is the stuff that's scraped off when a dentist cleans your teeth. A cusp is one of the pointed parts on the top of a tooth. A premolar can also be called a bicuspid because it has two cusp tips. Dry socket refers to this phenomenon of pain and inflammation in a tooth socket after the tooth is removed. A retainer